Hi folks, this is Hariom. Welcome to the second part of what is normal movement. This is in this part we are going to see what are the different definitions they have used for normal. Even though there are six definitions which was commonly used and where we have derived it from is David Sackett's definition of these different types of normal. We are going to do three definitions which are more pertinent when we are trying to define what is normal movement. So what is the definitions of normal movement, right? So if you are trying to define normal, most of the time we are trying to define normal in terms of biomarkers or impairments. Remember, there are three levels of measurement: impairments, activity level, and functional level. Most of the time a normal is defined in terms of impairments or biomarkers. You can also define in terms of activity as well as function, but most of the time it is defined in terms of impairments or biomarkers. The common biomarkers which you would have seen is your blood pressure. What is the normal blood pressure, or what is your normal x-ray and things like that, right? We know that normal x-ray is where the spaces are well defined. It is concave, convex, depending upon what region. There is no osteophytes and things like that. What is normal blood pressure? It is 190 by 120. What is the normal heart rate? 70 to 80. But in this definition, like we have been talking about variability in terms of movements, blood pressure or your heart rate, these are all variable. So you want to define in what context you measured, right? You want us to tell whether it was at rest or what age group. Remember, the age group resting heart rate or your resting blood pressure is different. What type of fitness levels they were. So all these things make a difference. So if you are taking a resting heart rate for a group of people in a particular age group, and if you plot all their heart rates, you will get this a bell-shaped curve. That's what they call it, a Gaussian norm. In the center of it, most of them will be in between 90 to 120. If it is blood pressure, it will be 70 to probably 80, 85 for heart rate. And we all know that what is a one standard deviation or two standard deviation. So in Gaussian normal, mostly they will take this part of it, that is beyond two standard deviation, we will consider it as abnormal, right? Likewise, you can also use percentile normal, also the same idea. For a particular weight, you should be at a particular height. For a particular age, you should be for a particular height and weight. If you are not there, you are underweight, probably malnutrition, that kind of things, right? This is a common way of saying what is a normal. You can also do the same thing for an x-ray also. The next definition is what we call as cultural desirable normal, right? This is what your culture is saying as normal, right? Remember Happy Feet? He was the only one actually walking straight like us, but he was considered as abnormal, and the other penguins wanted him to walk normal. They made fun of him and things like that. We also know I also know that a lot of parents, especially in the 80s and 70s when I was small, made the children who are left-handed to eat with their right hand, because it's considered a cultural norm to always use your right hand for doing good things, whether it is giving money or eating and things like that. So that's what we mean by a cultural desirable. And cultural desirable is what is difficult to define, makes medicine and normality a big issue. That is why we still have people who are disabled who are physically disabled, been discriminated, made to undergo a lot of problems because of we think that they are somehow that they are abnormal. The Mona Lisa picture is just to say that even though a lot of people say that, keep on saying that that what a beautiful painting. I am pretty sure she is just a ugly person, but a beautiful painting. We all think that she is beautiful because probably everybody told us she is beautiful. Now, in terms of Gaussian normal or in the cultural normal, it does not say beyond which range, beyond what number you are presumed to be having a disease or prone to have a disease. I'll give you a simple example: heart rate or blood pressure. If we know that if you have a blood pressure beyond 140 consistently, remember that's a word, consistently, and during rest, um, you will probably be labeled as hypertensive, right? If you are consistently at 120 139 between that range, they will not start you on medication most of the time, right? Probably they will tell you to do exercise, probably change your diet and things like that. So that 140 label or number becomes valuable. That's what they mean by diagnostic normal, beyond which range, if you are having that consistently, that is in the 140 to 160 range, you are higher chances of cardiovascular disease, stroke, death, all kind of things. But at the same time, if you look into an x-ray, right, they call this normal and this is abnormal. Really, how will we say that this joint space is abnormal, this is normal? If I have lesser joint space, do I have a perpetuity to get higher levels of back pain, right? Is my pain more if I have lesser, or my joint space or less if the joints are degenerated? Does it mean that I have more pain, I will have more pain than a person who doesn't have that? We know that that is not true. So there is no diagnostic normal in case of x-ray for back pain. Remember, an x-ray is for finding out whether you're normal and abnormal in terms of fracture, whether your integrity of your bone is there. That is where it is. There we have diagnostic normal, but not for x-ray for low back pain and things like that, right? So out of all these three normals I have said, one is the Gaussian normal, where beyond 2% or plus or minus 2 standard deviation, mostly it's considered abnormal. Similar ideas in percentile, beyond 95th percentile, they will consider it as abnormal. Or whether it is cultural normal, okay, this is how you have to behave, this is how you have to walk, that kind of cultural desirability. These two does not tell beyond which range you are going to have a disease, or your higher probability of having a disease or a problem, right? So one of the most important definitions of normal is diagnostic normal, right? Or a diagnostic beyond which range cutoff you have a problem. So we are going to use all these three definitions and try to use in our uh, abnormal signs of how abnormal movement happens, and try to define within these parameters, right? That we will see in the next video. Thank you.